Just a second. I pledge allegiance to
allegiance
the flag
to
of
the flag
the United
of the United
States
States of America,
and
to the
and
republic
for
for which it
stands,
one nation
one
under
nation
under
under
God,
God,
indivisible,
indivisible, with
and
liberty and
justice
justice for all.
In the Kiwanis mission statement, Kiwanis is
This is
a
a global organization of volunteers
dedicated
dedicated
to
to improving
one
the world
child,
one child and one
community at a time,
community at a time
through
through
service to others.
service to others.
So thank you. I'm still admitting people here while we're going through this. I see a Lisa on here. Lisa,
That's my guest.
I don't know who that is, but
Gary, that's my daughter-in-law. She's going to be a speaker next month.
okay, good. Okay, well, glad to have you.
Thank you.
Thanks,
So
thanks
is,
for joining us.
So it's Seth. He's on.
Yeah, and Caleb's
Month three.
in. Can't see Lisa or Caleb, but we'll see what we can do here. Invocation. Sharon, you got our invocation today?
I do. Would you bow your head with me, please? Our dear Heavenly Father, we thank you for this day and the opportunity to meet together as this Kiwanis group. We ask that you show us how to help the children of Montgomery County and the world. We ask that you be with our city, county, state, and federal governments. Show them your wisdom and understanding. Be with those who are fighting this pandemic, whether it is those that are afflicted by it or those giving care. We thank you and praise you for all you do. It is in your name we pray. Amen.
Amen.
Thank you, Sharon. Well, as we and we'll open it up in a little bit to Dr. Douglas, but just as I put out to everybody yesterday, the COVID vaccine is now open to those that are 70 and over. So you go sign up. It's at ourshot.in.gov. I know a bunch of people responded to me yesterday that they did get signed up, and that's great. So glad to see it. Volunteer opportunities, January 18th, which is next week. We're packing backpacks for the Nourish program, so we do need 3 more people for that. So let me know, whoever can work on packing backpacks. We need you next week. Jerry, you need speaker coordinator still?
We're down to 2 months that are open. I've got an opening in April and we have an opening in July. So please give it some consideration. Need your help.
Okay.
It's not hard to do.
Yeah, it's a lot of fun too. So in trying to find people, we had a lot of good fun with that. Operation Toy Box. We've agreed that Operation Toy Box will continue year-long now by providing toys to organizations that may use the toys during the year. Caleb and Karen have generously agreed to manage this program. And so I don't know, Caleb or Karen, either one of you want to tell us a little bit about your thoughts on this whole thing?
Well, we kind of figure that since we've got 1,000 toys left over, there's just a ton of them. And Dave Long was saying too that from last year we were unpacking toys from last year still, and it seemed like even from years prior to that. So since things just keep on coming, there are birthdays, there's the jump program, there's a lot of different things that are going on throughout the year that toys aren't just Christmas, and a lot of kids don't get birthday presents. A lot of kids could use just a little boost throughout the year. So we just figured, why not, if we're going to keep getting donations like we did this year, then let's keep getting the donations for the new popular toys for Christmas. And then, let's keep giving the ones that are still good out, throughout the year. So we'll see if working with Youth Service Bureau and Boys and Girls Club, if we can have a couple, side programs around that as well too. So we'll see.
Great.
If you guys have any ideas, send them to Caleb and I. Any ideas or any requests that come your way.
I'm sure Seth may know of some with his kids count therapy program, and I'm sure there are a bunch of others. So that's fantastic. And I really appreciate you guys taking that on. And Youth Service Bureau has offered us one of their storage units that they have to store the toys in. All the toys have been moved to that storage locker. So Caleb and Karen will work with Karen Branch in arranging when we need to get toys out of there for various organizations. So we're really looking forward to that, and I think that's really what we're trying to do. So glad to have everybody doing that.
Thank you both for volunteering to.
Yeah, thanks a lot. Thank you very, very much. Scholarship forms, scholarships have the applications have gone out to all the schools. Scholarship committee will be working on the applications as soon as they start coming in. And if you know of any high school seniors, get a hold of them and let them know right away. We'd love to make sure that these get out to everybody. So Scott, I see that you've joined us.
I have, thank you.
Where are you from, Scott?
Perry Township, down on the south side of Indianapolis. I'm a drug buddy with Dennis.
Oh, okay. You're a drug buddy with Dennis. Good. Okay.
And
The sheriff's not on.
Yeah.
we've been,
Well, that's, we need more, because I understand we need people to help with the putting in shots, but we'll find out from Dr. Douglas here in a little bit.
well, yeah, I actually retired the end of 2018, but Kroger asked me to come back to work for him, and I'm going to be doing flu shot clinics. So
Good.
maybe in your neighborhood, you never know.
Great. Scott, that's great. Glad to hear it. Thanks for helping out and doing what
You're
you
welcome.
do.
Scott's another one of my speakers coming up next month.
Oh boy,
He's got some good ideas
everybody
for
on
us.
here, huh? That's good. Lisa won't show her face. I don't know. She's not turning on her camera yet.
She's a busy mom, so she may
Oh,
be
okay.
feeding somebody.
Another announcement, of course, Sharon has announced a retirement as club treasurer at the end of this term. So we need a new treasurer. We're looking for a volunteer to take over the position. So we'd like to have them start helping out early, so they can learn before officially taking over in October of 2021. So remember, as treasurer, the pay is double what you get as being a member of Kiwanis. So you get double, right, Sharon?
Sure.
Yeah. Now, other announcements. I was hoping Bud could get on. He said he had problems earlier, and I tried to get him on here because I was going to tell him about that guy in California that was looking for the password to collect his 260 million in Bitcoin. I don't know if you heard about that guy, but can you imagine that? The guy has 260 million tied up in his Bitcoin, and he can't get to it because he can't remember the password. So write your passwords down. Member updates. Karen's with us today, so we don't have to give an update there. But any other updates on anybody? Nothing. Okay. Community involvement. We're not planning any in-person meetings, as we said, for the foreseeable future. We do have Pancake Week coming up in March. Caleb, you want to say anything about that?
Pancake Week will be, I guess that is last week of March. We have decided to do it during spring break week. That's best for McDonald's, and I want to keep them happy, but we figure if people are not really traveling as much as well, you're going to have a lot of parents that are going to need to get some food to their kids. So we're going to do it then. That will be then. The dates are going to start on Monday, the 29th. It's going to run through Saturday, the 3rd. We're still kind of determining what the Kiwanian role will be, since nobody really is going to have to do any serving this year since McDonald's taken all that over. Paul Jadell has graciously offered to see if one of their suppliers for his hotcake side will cover the cost on that. So we're just seeing how much further we can get our costs down. We're going to go ahead and set the price at $6, mainly just because even though we moved it up last year to 7, that was still all you can eat. It's not all you can eat at this point. You know, you're going to be going through the drive-through and just getting one thing. So we're going to go ahead and keep it at $6. That will include the hot cake, sausage, and a small drink of their choice. So we did have our meeting this week. The committee did. We're going to get started on sponsorships. If you are a business owner or know a business owner who needs to give some money to sponsor on that, let us know. We're going to be putting out pretty much as much ad campaign as we can through radio, through Journal Review, through the paper, Facebook, whatever we can do. And then pretty much hopefully see if we can't get a lot of tickets out. So those, hopefully we're going to look to get those printed within the next couple of weeks, hopefully next week, so we can get everybody their packages. We would like to have tickets back to us by the 15th, or at least ticket numbers for the most part by March 15th. That gives Paul plenty of time to get his orders in. And that gives us essentially, if we get it out to you next week, then that'll give you almost 2 months to sell as many tickets as possible. And then and we'll go from there.
Great. We have had people call. In fact, I was in the car the other day and somebody called and says, "Is this Kiwanis?" And I says, "Sure." And she says, "Well, when is Pancake Day?" And
Nice.
so they're looking forward to it. So this is a new way of doing it. And I think we'll probably need people, Caleb, we'll need people out there on the weekends and pushing it at the McDonald's stores themselves. And
Yep.
I hope Paul will let us do that in the drive-ups.
Yeah, he said that we're good for that. I figure we need to probably have some donation buckets for either Youth Service Bureau or kind of a local group as well. We can get some extra funds out there, and then we can also we could always have a small booth across from McDonald's during that week, maybe in the Kroger parking lot that sells the tickets. So that could be something else as well. So we'll figure out a couple things there and go from there. So
Good.
Will all tickets be $6?
yeah, we're not going to do because it's going to be the same
Okay.
amount of food regardless. So
Okay.
Caleb, are you going to print the instructions for how to do it on the tickets?
the tickets are pretty much going. Yeah, it'll just be take this to McDonald's and you're getting a meal that will include what we've said it's going to include. It won't include a special drink like tea or those, but coffee, soft drink, milk, orange juice. It'll include a small drink there. So, but the tickets will have that information on there. We're not selling tickets at McDonald's, meaning somebody couldn't go to the window and be like, "Hey, can I just go ahead and buy a couple tickets?" Because we don't want to have to expect the workers at McDonald's to take dollars for us and hold them. So it's the only people selling tickets are going to be the Kiwanis members, and or any sponsor who wants to have tickets at their location. And then from there, he's got a way that he can total up how many tickets were redeemed. What we were looking at was kind of our predecessor here is the Danville, Illinois club. They had an approximation of 4,000 tickets sold and only had 2,000 redeemed. So when you have something like that, you're essentially getting, 2,000 tickets that don't have a cost to it. It's just a free donation to Kiwanis. So if we have anything close to that, a 3/4 redeemed, that kind of thing, that helps the club a little bit more too. So we'll just see what those numbers look like.
That should be a selling feature. The fact that they can't buy it at McDonald's, you got to buy it ahead of time.
Right.
We should stress that.
Yep.
Good. Okay. Happy Bucks this quarter are going to Riley Hospital. So we want to get all the Happy Bucks we can get. So I know who's happy out there. There's Jerry. Jerry, you're on mute.
Sorry about that. I'll put a couple in, one for Riley and one because I got an appointment to get my COVID shot on Friday. So I'm happy about that.
Good.
Me too.
Gary,
Yes. Brian?
I'm happy that Purdue and IU are playing tonight. I hope I'm still happy after the game. And I'm also put another buck in. I'm happy my parents got their shots yesterday, their vaccines.
Great. Who else? I know I'm happy that at least we got it down to 70. Now we got to get it below that for Terry and I and others. So and I know, you know, looking around here on these windows, you know, there's at least 3 or 4 that need to get it below all of that. So let's get it down there and everybody get their shots. Anybody else happy?
Hey, give me an address and I'll send you $10.
Thank you so much. It's P.O. Box 611,
Okay.
Crawfordsville, Indiana,
Yep.
47933.
I actually lived there for a year.
Well, see,
Crawfordsville. Yeah.
Scott.
So I'm happy because I became a Make-A-Wish wish granter.
Wow.
So I get to work with the kids that are terminally ill and be in the program and from the beginning when they ask for a wish and then stay with them for 6 to 9 months till their wish is granted, and then I get to grant the wish. So really excited about doing that.
That's fantastic, Scott. Thank you so much.
You're welcome. Whose name do I put on the address?
Just put Crawfordsville, Kiwanis.
Oh, okay. Got it.
Shar, your camera is not on. We see you here, but your camera's not on.
Well, I just got the app on the phone and I don't know what I'm doing. I have laptop problems. So
okay.
Somebody take attendance and send it to me, please.
Well, Karen's on here, so she's
okay. If Karen's on there, then she'll take care of it.
Sure, I got it.
That's right.
Thank you.
So
You're welcome.
thanks. Okay. Anybody else happy?
Yeah, can you hear me, Jerry?
Yes, Andy.
Gary?
Yes.
I'm not really putting a happy buck in for me, but for my wife, because I went back to work this week.
That's good. Boy, it ought to be that ought to be worth a bunch to her.
She's not here to put the money in, but I'll put it in for her. I'll determine the amount later when I how much it's worth.
That's right. There you go. Thanks. Okay, this day in history, January 14th, 1690. The clarinet was invented in Nuremberg, Germany. So who plays the clarinet? Anybody here? No, huh? Okay. Well, that was an old one. 1784, the U.S. Revolutionary War ends with the U.S. Congress of the Confederation ratifying the Treaty of Paris. 1794, this is one for Dr. Douglas. Dr. Jesse Bennett of Edom, Virginia, performs the first successful cesarean section operation in the U.S. And he did that on his wife. Interesting. I guess they both lived. In 1916, the Dutch Zuiderzee dike cracked on this day. And on this day in 1917, the little Dutch boy celebrated his first anniversary of holding his finger in the dike. 1952, the Today Show premiered on this day. And let's see, national days. This is Cuckoo Dancing Week. So anybody that Andy was talking about going out dancing, so anybody that wants to dance like a cuckoo, you can do that this week. It's also Cesarean Section Day. I don't know how that came about. It must have been Dr. Bennett. It's National Dress Up Your Pet Day and Take a Missionary to Lunch Day. So you've all got stuff to do here. Birthdays. This is the oldest one I ever had, 83 BC, Mark Antony. Today's his birthday. It's also Benedict Arnold's birthday, 1741. Guy Williams in 1924. Anybody know who Guy Williams was?
Yeah, he was an actor.
And what did he do? What did he play?
Zorro.
Yeah, he played Zorro. And I didn't realize this, but he was also the professor, the dad in Lost in Space.
Yeah, that's right. He was.
Yeah.
Without the mask.
Yeah, that's right. Without the mask. 1939, Jack Jones was born. And
Good singer.
many different songs. Well, what's the song he's most famous for?
Well, Lady was one of them, and Wives and Lovers was the other one, the big one probably.
Okay, the big one is Love Boat Theme.
Oh yeah, that's right. Yeah.
You know, 1941 was Faye Dunaway, and 1968 was James Todd Smith. Anybody know who that is? LL Cool J.
Oh.
Anybody know what LL Cool J stood for?
Ladies love Cool James.
That's right. Very good. Good. All right. Kawanian birthdays this week. January 16th. Terry Bailing. Oh yeah, it's her birthday. And January 18th is Craig Burkhart. So happy birthday to our fellow Kawanians.
Hey, Gary.
Yes.
To go along with your cesarean section day, there was a guy in Waynetown by the name of Caesar Simpson, and he supposedly was the first cesarean section at Culver Hospital. So they named him Caesar.
Wow.
That's just a story. I'm just relaying the stories.
Very good. Very good. Okay. What I'm going to do now is I'm going to introduce Dr. Douglas. Going to put everybody on mute. So Dr. Douglas, you're going to have to take yourself off mute to speak. But, you know, when I Googled Dr. Douglas, I found out that came up that he's a veteran running, fitness, and health journalist whose lifetime running odometer has passed 110,000 miles. Oh, that's the wrong Scott Douglas. Sorry about that. Doctor, it came up, it came up as Scott Douglas. So Dr. Scott Douglas is the health officer for the Montgomery County Health Department. He's a family practice physician with the Franciscan Physician Network, Crawfordsville Family Medicine. His work also includes serving as a student health provider at Wabash College and medical advisor for the Crawfordsville School Corporation. He grew up in Indianapolis, graduated from Wabash College in 1984, is a 1988 graduate of Indiana University School of Medicine, and completed his family practice residency in 1991 at Methodist Hospital in Indianapolis. Served 3 years in the Air Force as the chief of family medicine at Dyess Air Force Base for the 9th Bomb Squadron in Abilene, Texas. Married to Jamie Douglas and has 2 children. Active in his local church and enjoys
and this is an incidence map. So incidence is the number of cases per day per 100,000 population. And so this was the United States. The red is when there's more than 25 cases per 100,000 per day. And you can see the southern states, they came out of their lockdowns a little bit early, allowing folks into bars and crowded settings and there were no mask mandates in these states at this time. So they started having some trouble. This is a month later, this is August 16th, they started making some adjustments and their incidents started dropping down. So you see less red in those lower southern states. But then this is October, and this is October 6th, and we start to see increasing numbers of cases in the Midwest. And in October, things started to look not very good for us in the Midwest and in Indiana. At this point, Indiana was sitting 21st worst in the United States. So we were kind of in the middle. I'm going to expand this, but that one green dot in Indiana is Montgomery County. And so back then, we just thought we were it. We thought we were patting ourselves on the back, thought we were just doing a great job with our billboards and our public education. And But that was short-lived. There's the state incidence. This is not the governor's metric map. This is still just one parameter, and that's the incidence. And this is that first week of October. We really thought we were doing great. But this is just 2 weeks later in Indiana. Cases started to go up, and very quickly. This is October 14th. This is October 19th. The red is filling in pretty dramatically. This is November 16th, when the cases soar really all across the Midwest. The coasts were still doing better, but I think in the Midwest, we thought we weren't California, and we thought we weren't the East Coast, and we didn't think we needed to be pay attention, I think, or comply with mandates as much as the coasts were. Here, Indiana was sitting 12th worst among the United States. Here is December 1st, and Indiana is up to 9th worst in the country. There we are, our whole state on December 1st was in the red in terms of incidents. And then by December 8th, Indiana was sitting 4th worst, with Alaska, South Dakota, and Nebraska worse than we were in incidents. So on the right-hand side of this chart, you can see Indiana with 102 cases per 100,000 per day, 7-day rolling average. Alaska, really pretty high, over 200. And then this is where we are right now. This was as of January 10th, and Indiana's sitting 17th here. So other states have caught up with us and passed us in terms of their incidence. So this is Montgomery County, and these are the positive cases by day. And the brown line is a 7-day moving average. And so the important thing here is on October 1st, we were running our 7-day average was 1 positive case a day. And then it started to go up dramatically through October and November. And it peaked 2 weeks after Thanksgiving with our positive cases running 56 cases a day on a 7-day running average. This mid-December for Indiana and for Montgomery County was really bad. And I know there's just a lot of noise out there. Every time you turn on the news, you see pictures of hospitals overrun and so on. And it's really hard to put any kind of thing in perspective in terms of what does that really mean for us in Indiana. But we had real trouble in the middle of December, a couple weeks after Thanksgiving, when we had a surge that we were expecting to see. We had real trouble with Indiana hospitals, and we had about a week where our local hospital was full, the Lafayette hospitals were full, and Indianapolis hospitals were full. We had, during that time, there were several days where bed holds in the ER, and those are folks who need to be hospitalized. They can't go home. They have to stay in the ER. The bed holds in the ER are when there's no bed available in the hospital. And up in Lafayette with St. E's and IU Arnett, there were several days where their bed holds in the ER were up to 10 patients waiting for a bed. I had a patient of mine during this time go into our emergency room with a very serious cardiac arrhythmias, got shocked a couple times in the ER, desperately needed desperately needed to be in a tertiary care hospital with a cardiologist, and the hospital here was full, the Lafayette hospitals were full, and we couldn't get him a bed in Indianapolis. He sat in RER from 9 a.m. on a Wednesday morning until 5 a.m. on the following Thursday morning. So almost a 24-hour wait to get to a bed to get some critical care for that person. So that was very alarming to us. And that was during this peak of positive cases by day. You can see that after that mid-December peak, it came down in that low portion at the end of that graph. That was right at December 26th. And now you can see we're starting to climb again in the last couple of weeks, which is what we've kind of expected with the holidays, with folks getting together and transmitting the infection. So this is the state deaths, and it mirrors that same problem that things peaked right at 2 weeks after Thanksgiving. And at the peak, the state was experiencing 86 deaths a day on a 7-day rolling average. And we're down now to about 60 deaths a day on the statewide rolling average. But we're bracing, still worried that we haven't faced the full rebound or upsurge after these recent holidays. This is the governor's map in Indiana, and it's really two parameters. It's the incidence based on the number of cases per week per 100,000 residents, and also the 7-day positivity rate that we get a score. So this is a score on November 29th, before we had that big surge. The red counties are the ones that when you hear about going red because of the incidence and positivity rates. But this is where Indiana was. Montgomery County had a score of 2.5, and when you go to a 3, then you get designated as red. Here is where we are this week in Indiana. 73 counties are in the red in terms of incidence of COVID, and the positivity rate being above 15% puts you in the green, or in the red here. So that's where we are right now. So, and that's me getting my first dose of vaccine up in Lafayette at IU Arnett Hospital. So I'm going to come back. I'm going to close out the screen sharing and come back. All right.
We lost your,
right.
There you go.
Yep. Are we okay? All right. So before we talk about vaccine, because I know there's going to a lot of interest in that, I do want to talk about monoclonal antibody infusions as a treatment. So far, the only treatment that has been shown to be effective for folks who come down with COVID as an outpatient, the only treatment that's been shown to decrease emergency room visits and hospitalization is an infusion of monoclonal antibodies. And so this is a product from Eli Lilly that the state has. It is another company is making another monoclonal antibody called Regeneron. That's what President Trump got a dose of that. But monoclonal antibodies are antibodies that fight COVID, and they are made in a lab as opposed to convalescent plasma. So you've probably heard of convalescent plasma is antibodies that come from a person who has had COVID and has recovered and has mounted an immune response. and they donate their blood, and the blood cells get taken out of it. When you take blood cells out of the blood, you're left with plasma, and plasma has lots of proteins in it, but one of the proteins in plasma are antibodies. So folks who have had the infection have antibodies in their circulation. We can take those antibodies and infuse them into a patient that has COVID and help them fight the infection. So that was our first use, was from actual people that had been sick, and that's still being used in the hospital settings when folks are terribly sick and looking at ICU admissions. They're often being given convalescent plasma, but these monoclonal antibodies are actually made in a lab. They don't come from a person. They are administered through an IV as an infusion. That takes 1 hour to get the infusion, then you have to be observed for an hour. And it's indicated for anybody over the age of 65 who comes up positive with COVID. And it's indicated for anybody over the age of 55 with certain underlying at-risk conditions like high blood pressure, diabetes, lung disease, and so on. So the sooner it's administered, the more effective it is at helping to prevent somebody from getting sicker. As you can imagine, it's difficult to, this is not the kind of thing that's being provided in doctors' offices. They just don't have a setup to provide infusion clinics in doctors' offices. The places where we normally would provide infusions are typically oncology centers where folks are going to get their chemotherapy. So we can't have COVID patients going into oncology infusion centers to get treatment. So there's been some difficulty in rolling out the monoclonal antibodies. But in our area, Franciscan has an infusion clinic up in Lafayette. So if you come up positive for COVID and you are over the age of 65, receiving an infusion of the antibodies can decrease the chance that you might end up in the hospital. It is still only approved under an emergency use authorization. So it's still investigational, and there's a lot we don't know about it. And so it appears that the side effects are relatively low, and the benefit is hopefully decreasing hospitalizations with the infection. So I want everybody to be aware of that. It has to be ordered by a doctor. So if you come up positive for COVID, you need to notify your doctor. And so many folks are getting their tests for COVID through the state, and your doctor doesn't get notified when you are positive. So if you end up with a positive test, you need to contact your doctor and say, hey, I just got notified I'm positive, and the doctor can then help get you scheduled to go up to Lafayette and to get an infusion to prevent the infection from making you sicker. So that's my public service announcement on those monoclonal antibodies. It turns out that we were really worried there would be a big shortage of those because we thought the demand would be very high, but the demand is fairly low, and I think it's mostly because folks just aren't aware of it. And so we want to get that message out there. All right, vaccine. Vaccine is what is going to get us out of this. We just started in Montgomery County. Right now in Montgomery County, we have 609 folks that have been vaccinated based on the state's dashboard. And most of those are healthcare providers who had to go to Witham or up to IU Arnett to get their first round of vaccine. We started our clinic here on Monday, and this happened very quickly for the health department. There was a lot of uncertainty in terms of how much vaccine we were going to get. And last week, we got our first shipment or allotment on Friday, and it was only 100 doses. And we were crushed. 100 doses is nothing. It makes hardly any dent at all. And but we got the clinic put together, and folks came in on Monday. I think we vaccinated like 56 folks on Monday in the clinic, and then yesterday another 50 plus got vaccinated. We got some additional vaccine Monday morning. It's very difficult for us to plan because we just don't know from day to day how much vaccine that we're going to have. But the state indicates that they're going to start pushing it out at a faster rate. So we will be able to increase our throughput and increase the amount that we're getting into arms fairly quickly. The health department, we have only 6 employees in the health department and 1 nurse. And so this whole effort at vaccine and vaccinating is really very heavily volunteer dependent. And we've had a number of nurses in the community step up to offer their help, which is critical because we cannot do this without the volunteers to do it. And so we have paramedics volunteering, nursing volunteering. There's a whole category of folks that can help immunize, including pharmacists, medical students, nursing students. The state has liberalized the professionals that are allowed to take part in administering the vaccine, so that we have a bigger labor force of volunteers. So normally students wouldn't fit the criteria to work in this kind of setting, but the state has liberalized that so that we can use medical students if they're available. We're currently going to be providing the vaccine Mondays, Wednesdays, and Saturdays. And we have the ability to really ramp it up significantly as the supply comes in. Questions about the vaccine, folks want to, there is some, out there about side effects. For most folks, the side effects are similar to other immunizations that you get. Statistically, it looks like about 84% of folks who take the shot will have a little bit of soreness at the site. About 63% of folks will say they get a little bit of muscle ache that's more generalized, or a little bit of fatigue. And some folks have said they've had a bit of a headache. In terms of serious reactions, it's less than 0.5% of folks that take the vaccine get a serious reaction. The most serious of which is anaphylaxis. And you might have heard of anaphylaxis is an allergic reaction where blood pressure plummets. Folks have real airway trouble with wheezing and tightness, sometimes swelling in the airways. And it can be a life-threatening, immediate, sudden allergic type of reaction. The CDC published about 10 days ago a report on the Pfizer vaccine that they were seeing that type of serious reaction in about 1 out of 100,000. And in the state of Indiana, we've given 219,000 doses. And Dr. Box yesterday reported that we've had 2 cases in Indiana of anaphylaxis. So that what we're seeing in Indiana, that 1 out of 100,000 seems to be consistent with what the CDC was also reporting. Vaccine sites are all required to have on hand the epinephrine and appropriate treatments for treating that type of a reaction and getting folks transported to an emergency room if that's to happen. So that rate of anaphylaxis is a little higher than other vaccines that we give. So it's not without concern. But we do, I think you have to weigh it against the risk of COVID. And we are, with COVID circulating, you're going to get one or the other. If you get the vaccine, you're not likely to get the infection. If you don't get the vaccine, you're going to be susceptible to getting the infection. And over the course of this next year, you're going to have probably one or the other. If you get the infection, the case fatality rate for the infection, and that's calculated, in fact, this IU Fairbanks School of Public Health has done studies on this in Indiana. The case fatality rate, in other words, what percentage of folks die of those who get the infection? And in Indiana, it's 0.6%, so less than 1%. If you take out the nursing home folks and want to know, well, what about folks who are not in the nursing home, who are in the general community, what's their fatality rate? And it's 0.26%. But in any case, at that rate, that ends up being, if you look at the 0.26% for folks in the general community, that ends up being 260 deaths per 100,000 people that catch COVID. So you're either going to face that 260 deaths per 100,000 versus one serious anaphylactic reaction per 100,000. You're going to have to face one of those. And so I would strongly encourage folks to take the vaccine. Now, if you've had a serious reaction to previous vaccines that includes anaphylaxis, then we want you to talk to your doctor about whether the risk is worth it. So folks who have had previous serious anaphylactic reactions are at risk for having another one when they take a vaccine. So those folks, we want to know about that. If you've had that kind of reaction, you need to, if you're at the vaccine site, you need to tell folks that you've had a reaction before. And we really would like you to talk with your doctor about it beforehand to be sure that your doctor feels that you're, because of your past history, that you'll still be okay to go forward. So I'll stop there and try to answer questions for you.
Scott, what's the drill if you think you've got the symptoms, but you've never been tested? What do you do?
So there in Montgomery County, there's 2 routes to getting tested. Well, more than 2. Right now, some of the Franciscan primary care offices has rapid tests available through an ID Now machine, an instrument that the Franciscan primary care offices have just gotten in the last 2 or 3 weeks. So that's one option, is your doctor. Your doctor can also order a test and then schedule you to go through a drive-through swab at the hospital, and those are offered every afternoon, Monday through Friday. And then the health department and the city have teamed up to also do testing. The city, through paramedics, are doing swabs on at the old, well, across from the police department in the old Horner car lot there downtown on Green Street. They're doing testing there Tuesdays, Wednesdays, and Thursdays. And the health department, which is now located at 308 West Wall Market at the old building of Crawfordsville Family Care, they're doing testing there Mondays and Fridays. And the way you access that testing is you can go to the ISDH website and search under test sites and community testing. You enter your zip code, the Green Street site shows up, and the health department market site shows up, and you can search for an available time and register online. They give you a time, you just drive in. You don't get out of your car. They'll just swab you and send you on your way. And that, so the accessibility to testing has increased significantly from where we were in March and April. But it's online scheduling. so that there's really very little interaction when you're at the site. You just have to show an ID to confirm that you are who you say you are, and they'll do the swab. The results come to you through email or through text message to your phone as soon as the tests are resulted. And then if you have a positive test, you would be contacted by state contact tracers to give you information about isolation and for yourself, and then about quarantine for those who've been exposed to you.
Scott, the rapid test, I had a rapid test first and it turned up negative. And so they went ahead and did the more invasive test and that came up positive. What's the percentage of a rapid test as far as the accuracy of a rapid test?
Yeah, so if a rapid test comes up positive and you have symptoms, we feel that that's very reliable. If you have symptoms and a rapid test comes up negative, rapid tests do have a high rate of false negative results. And that may be as high as 30% of folks who have the infection and get tested with a rapid test. About 30% may end up with a negative test, even though they have the infection. And so with those rapid tests, we recommend, if you have symptoms, that then you follow it up with the PCR test, which is a polymerase chain reaction test. That's the one that they collect and send off to a lab. And that's the one that's that's the best test we have. We call it the gold standard. And even that one has a fairly high rate of false negatives, but it's the best thing we have. So if you have a negative rapid, we'll send off a PCR if you have symptoms. Because
one other question. My wife has taken epinephrine because she's allergic to bee stings. Does that enter into this reaction to the vaccination, that she has had a negative experience with bee sting?
Yes, it is something that we would be concerned about. And at the vaccine centers, we have guidance that most folks that come through and take a vaccine, we require a 15-minute observation period. But if somebody gives us a history that they've had a significant reaction before, then we will watch them for a 30-minute observation period. If folks have had an anaphylactic reaction to an immunization before, that we would be pretty concerned about proceeding with giving the vaccine. If they've had, there's a lot of folks that will have EpiPens for the treatment of an allergy, but they may not have actually ever had an anaphylactic type allergic reaction. If they've actually had an anaphylactic type allergic reaction, then those folks, we're going to observe them longer, 30 minutes.
Okay. Yeah. Oh, by the way, since you can't say it, I can. I had the infusion and got along very well, and I think it kept me from getting a lot worse, and I appreciate that. I just sent Scott an email and said, "Hey, I'm positive. What do I do now?" And he got me set up with the infusion, and I was very appreciative because it, I think, really kept me from going over the top a little bit.
Hey, Scott.
Yeah.
Brian here. Just a question for you. My parents got their vaccines yesterday, first dose. What's your opinion or the advice when we haven't seen them in 9 months or 10 months or whatever? How long do you wait? Do we have to be vaccinated also, or what's the recommendations?
Well, of course, you're not fully vaccinated until after that second dose, and so the CDC says you really can't assume full response until 2 weeks after the second dose. the vaccines were going to make us feel a lot more secure, but no vaccines are 100%. And so we would still encourage caution. So after your folks, for example, get their second dose, you're going to feel safer about having the kids around them and meeting with them. But I don't think you're going to be willy-nilly about it. You're still, I think, going to be concerned about hand washing and kind of staying distanced and wearing a mask if you're indoors together, simply because the vaccine is not 100%. It's pretty dang good. It's about 95%, which is outstanding as vaccines come. Our influenza vaccine is only about 70% effective. So it really is very effective, but we still worry. And so we don't want folks to be willy-nilly about it. We want folks to continue with some, with precautions, but I think you can take a sigh of relief once they get that second dose, that their risk has dropped off dramatically after they get that second dose.
Scott, there were some reports in the news last night that said that the new administration is considering releasing all of the stockpiles in an effort to get as many people out there as possible vaccinated. If you take the Pfizer vaccine, does your second dose have to be the Pfizer vaccine, or can you mix Pfizer and Moderna since they were both RMNA derived?
No, you have to match it with the same product that you got.
So Scott, is the rate limiting step right now the supply of vaccine? And would you say that if you have an appointment, you're guaranteed that vaccine?
Yes, the rate limiting step is the amount of vaccine, and the state, which is controlling the appointments, is controlling the logistics. So their plan is to follow up each county with the amount of vaccine they need to hit their new people on the schedule. But then the state is also going to help with the allocation to ensure that when the second dose comes around, that we will get supply for that. Now, there is a little bit of concern that if it all gets released from the stockpile, right, that we may run into some logistics problems with the second dose. But the manufacturers have been indicating that they think they can ramp up significantly production. So the hope is that they'll be able to keep up.
If you get the first dose and the second dose is delayed, is there any evidence that it delay or that it reduces the efficacy of the vaccination?
Well, it's an answer we don't know. And so, the way a manufacturer, a pharmaceutical company takes their best guess in terms of what's going to be the most effective based on previous studies and so on in terms of taking the vaccine, and then they design a study to prove that works. They don't design a study to prove that a whole bunch of other different dosing regimes work or not. So they've proven that their particular interval, 3 weeks for the Pfizer, 4 weeks for the Moderna, works. It's not to say that if there's a delay and you take it 8 weeks later, you're still going to get some benefit out of that. There's just not going to be any data. They haven't spent the money to prove that.
Scott in Indianapolis, I have a couple comments and a couple questions. First thing is because of what's going on with Eli Lilly, their stock just went up $20 a share. So if you have Lilly stock, you've made a lot of money. And the second thing is I have a friend whose daughter works in Bloomington, and there is a lab down there that was part of Cook Medical that's producing tens of thousands of vials of vaccine a day down there. So, so my couple of questions. One is, if you get your first dose and you end up traveling or going somewhere, I understand that you can get a shot anywhere in the United States. I mean, as long as you make an appointment or whatever. So would you be on like some type of national record, or somewhere to prove that you had your first dose? And the second question is as my son calls us in the elderly category, are all shots paid for? I know under Medicare they're covered, but what about people who are younger than 65 who need the vaccine? I mean, do they end up having to pay for that?
Yeah, first of all, in terms of cost, the CARES Act is covering the cost of the vaccine.
Okay.
So nobody should pay anything for the vaccine itself. That's all being covered by the federal government. There's an administration cost that, and that right now, some health departments are filing insurance for that. Some aren't. You know, if you can imagine, health departments really weren't in the insurance business. So they really weren't set up to collect insurance information and do that kind of things. But there is an administration fee that might be charged to your insurance, which is like a $26 fee for providing the vaccine. In terms of going anywhere in the country, the answer is yes. You ought to be able to, you know, if you're a snowbird, for example, and get one dose in Indiana, you ought to be able to go to Florida and get your second dose down there. There's not a national database that would have you on it, but when you take the vaccine, you're provided with an official vaccine immunization card that shows as your name and that you received your first dose. So you take that card with you. Indiana has a vaccine register called CHIRP. And so anywhere within Indiana, if you get one dose in one county, you can end up getting another dose in another county. Although we prefer that you go to the same site that you got your first dose, because that's how it's being allocated.
Okay.
Is Montgomery County getting the Pfizer or the Moderna version, or is it a mix of both?
We're getting the Moderna, and that's the one that doesn't require such intense cold storage.
So, Scott, the UK variant is discovered here in Indiana. Is the state health department actively screening for its presence in all counties? And if it should turn up here in Montgomery County, how would you change your recommendations for social gatherings and that sort of thing?
I don't
mean to put you on the spot.
Yeah, I don't know if there's screening for it specifically by county. The last week, well, the week before, the state announced that they had some specimens that they thought were probably going to end up being confirmed as the more contagious variant, and then Wednesday of this week, Dr. Box confirmed that it was the more contagious variant. I think that being more contagious, I think we're just probably going to end up assuming that it'll end up being ubiquitous in the state. And yes, it does appear to be more contagious, which is, of course, not very good news. We've had little outbreaks that are just alarming. You know, a family of about 20, you know, getting together before Christmas ended up with 11 positives. You know, they all met, you know, within one home, and of course had shared a meal, and we're all in close contact. So that's a pretty high case attack rate, you know, over 50%. And another family of 13 with 9 people coming up positive after their little gathering. Folks just don't. I think it's hard for Midwesterners to believe or understand that this is here, and just as alarming and just as serious as what they see in LA. You know, in terms of just because we're Midwesterners doesn't mean that we have some magic force field around us that keeps us from getting the infection.
How do you feel about reinfection? So as everybody on here knows, I had it over Thanksgiving, before Thanksgiving. So, I mean, I know there's been some talk of a 3-month immunity, a 6-month immunity. Really, you don't have immunity. How do you feel about that?
Well, so our guidance is that that if folks have had a confirmed case, the CDC is prepared to say that that we can consider you immune for at least 90 days, meaning that if you are exposed to somebody else that was positive, that you would not need to be on quarantine because of that, because you would have some natural immunity and we wouldn't expect you to come down sick again. Getting reinfected, it appears, does occur, but it's very, very rare. And that checks with other things that we've seen. You know, we used to, you know, in kids that would get chicken pox 30 years ago, we felt that once you had a case of chicken pox, you were immune. But every once in a while, rarely, but every once in a while, you get a kid that got it twice. But it is very rare. We think that the immunity probably is a lot longer than 90 days, but the CDC is very conservative, and they're not going to make a claim until they have enough data to add, you know, to prove it. So, but there have been some studies that clearly indicate 6 months is an easy target. It's probably, we're all probably pretty good for 6 months after the infection, and it's going to probably be longer than that, but we just don't have the experience to make those kinds of claims yet.
Scott, if I could put on my city council hat now and just say to you that I think all of us, I can speak for a lot of people of the dedication that you've shown in this pandemic and the leadership. And I posted this on Facebook, and I don't know if you saw it or not, but I really meant it, because I think the right person was in the right place at the right time. And I just want to compliment you, and you're pulling Dr. Roberts in and the Montgomery County Health Department and all the hard work that you've done that has really, of course, by your charts, it looks like we're pretty high, but it isn't because we haven't been informed, because you have kept an open line to the community. And I just think you deserve a great compliment for your leadership abilities during all this. So I'll take my hat off now. So.
Well, thank you very much for those kind words. I do want to say Montgomery County, I think, is a little bit unique. The city county communication and cooperation, I think, is very unique. Mayor Todd Barton was instrumental in helping us get the old county market building so that we could set up the vaccine clinic there. We've had a great collaboration with the city fire department and the paramedics we've gotten them their supplies to do the testing, and they've jumped right in to do testing here in Crawfordsville. And we've been hearing from a lot of counties that kind of cooperation is not occurring. And so I really think the city county relationships here have really helped out significantly.
You know, you guys in small cities, I grew up in a small town out of state, but I mean, you guys are so fortunate because of the cooperation that people have, like you were talking about. And I know in big cities like Indianapolis, there is so much frustration trying to get in. A friend of mine, because I'm actually in Johnson County, and when you went and looked, all you did is put in your date of birth, and it was 192-minute wait time just to be able to have them come back to tell you when you could get a date to be immunized. And I mean, there is so much frustration. I know early on, my wife had gone to one of the health department outlets and got a test, and they told her that for the test it'd be 5 to 7 days, and she didn't hear anything. And so she called them on the 7th day and they said, oh no, that's 5 to 7 business days. So at 10 business days, she called them again and they said, well, your test was indeterminate. We couldn't figure out whether you had it or not. So we just not going to let you know anything. I mean, they're so overwhelmed with the amount of people and things that are going on. I know we used to do rapid tests at a Walgreens stores, and before it got really bad, you'd get a test in a half an hour and you'd go sign up on Monday and you could go Friday and get your test. Now you can't get anything. I mean, it's so far behind that. You guys are so fortunate out there.
Got the news reported this morning that Johnson & Johnson has a new vaccine that only requires one shot, doesn't require, rigorous refrigeration. Looks to be fairly effective, although they didn't have any percentage rates. But what's your feeling about a vaccine that's derived from dead virus as opposed to something that was created genetically, the rMNA type that Pfizer and Moderna use? Is there any history as to one being better than the other?
I know the AstraZeneca vaccine that was being developed primarily in Europe and the UK was using. That's a vaccine where they take an adenovirus. Adenoviruses are viruses that are common cold viruses. Take an adenovirus and put a string of DNA into the adenovirus and then use that virus to replicate within the patient and to deliver that DNA target. That the information I saw on the AstraZeneca indicated that its effectiveness was only around 70%. So I don't know about the Johnson & Johnson product. These vaccines, the Pfizer vaccine and the Moderna vaccine are nothing like any vaccines we've ever had before. They are completely a unique delivery system, completely different way of vaccinating, and that may explain why it's pretty, the effectiveness is so good. So I don't know about the Johnson & Johnson product, and there's a niche for all of these. With that product, the rest of the world may really depend on that product that doesn't require deep freezing and requires one dose. As you can imagine, in developing countries, that has a big role to play. So it just may be one vaccine might be suitable for one area and another vaccine would be the best choice in a different region.
Wow, we went a little bit over, but I do appreciate it, Dr. Douglas. You've keeping us informed is probably means the most to us as far as knowing what's going on and knowing the right way to go. So we do appreciate your time, and like Andy said, we appreciate all your efforts. You have kept this county going with this whole program and the process, beginning with the testing and now the vaccines. And we look forward to when all of us can have the vaccine and we get back to some type of normalcy, whatever that be. So thank you so much for being with us. Anytime you want to come and join us, every Thursday we're open. We do have a Thursday the 28th. I don't know if you know him, but a Dr. Kevin Mackey, who's out of, he's a professor at IU School of Public Health in Bloomington. He's a founder and chief scientist of Midwest Biochemical Research and a epidemiologist who's going to talk to us on the 28th. So I can send you the information if you'd be interested in listening to that too.
Yeah, thank you very much. And before I go, I'd like to say that over at the health department, Amber Reed, who's the administrator of the health department, you know, all of this logistics and planning all falls on her shoulders, and she's the one that really keeps this thing going. And so it's not me that's the boots on the ground, really. It's the other folks at the health department, and especially Amber Reed, who's making this thing work. So if you run into any of the health department folks, they are working their butts off, and so pat them on the back.
What
Or
did
give
you
them
say
an
the
elbow.
address was to the health department again?
It's now a 308 West Market.
Okay. I just thought I might want to send them a card, so thank you.
Oh.
Yeah, thank you so much for everything you do. Our next meeting will be January 21st, and our speaker will be Professor Stephen Jones from Wabash College. A little bit different than what we've been doing with all of this pandemic stuff, but hopefully we can go in a different way. Quote of the day: as you grow older, you will discover that you have two hands, one for helping yourself and the other for helping others. Audrey Hepburn. So let's use both hands.
Oh,
Thank you so much.
well, just